Welcome to Health and Psychology. Join us on a journey to better health and well-being. Subscribe for expert insights, practical tips, and the latest in health and wellness. If you're finding value in our content, show some love by liking and commenting. And if you haven't already, be sure to subscribe to stay in the loop for future videos. Mental illness refers to a wide range of conditions that affect a person's thinking, emotions, behavior, or a combination of these. These conditions can significantly impact a person's daily functioning, relationships, and overall well-being. Mental illnesses are often characterized by alterations in mood, cognition, or behavior, and they can vary in severity from mild to severe. The causes of mental illness are complex and can vary depending on the specific condition. Mental illnesses can result from a combination of genetic, biological, environmental, and psychological factors. Here are some key contributors to the development of mental illnesses. Genetic factors. Some mental illnesses have a genetic component. Individuals with a family history of certain conditions may be at a higher risk of developing them. Neurochemical imbalances. Imbalances in neurotransmitters, chemical messengers in the brain, can play a role in conditions like depression, anxiety, and schizophrenia. Brain structure and function. Differences in brain structure and functioning, including areas responsible for emotions, cognition, and behavior, can contribute to mental health disorders. Early life experiences. Adverse childhood experiences such as trauma, neglect, abuse, or unstable family environments can increase the risk of developing mental health conditions later in life. Traumatic events. Traumatic experiences, such as physical or sexual assault, combat exposure, natural disasters, or accidents, can lead to conditions like post-traumatic stress disorder, PTSD. Chronic stress. Prolonged exposure to high levels of stress, whether due to work, relationships, or other factors, can contribute to the development of mental health disorders. Biological factors. Hormonal imbalances, disruptions in the immune system, and other biological factors can influence mental health. Substance abuse. Substance abuse, including drugs and alcohol, can both contribute to and exacerbate mental health conditions. Medical conditions. Certain medical conditions, such as chronic pain, neurological disorders, or hormonal imbalances, can impact mental health. Environmental factors. Environmental factors like exposure to toxins, pollution, or certain chemicals may play a role in the development of mental health conditions. Social isolation and loneliness. Lack of social support, isolation, or loneliness can contribute to the development of depression and anxiety disorders. Personality traits. Certain personality traits or styles of thinking may make individuals more susceptible to certain mental health conditions. Now let's talk about symptoms of mental illness. The symptoms of mental illness can vary widely, depending on the specific condition and the individual. It's important to note that experiencing one or more of these symptoms does not necessarily mean a person has a mental illness, as some symptoms can also be related to other factors. However, if these symptoms persist or significantly impact daily functioning, it's important to seek professional help. Here are some common symptoms of mental illness. Changes in mood. Persistent feelings of sadness, hopelessness, or mood swings that are significantly different from a person's usual disposition. Anxiety and worry. Excessive, uncontrollable worry, fear, or nervousness that interferes with daily activities. Difficulty. Concentrating or making decisions. Trouble focusing, making decisions, or experiencing memory problems that impair daily functioning. Changes in sleep patterns. Insomnia. Difficulty falling asleep or staying asleep, or hypersomnia, excessive sleepiness or prolonged sleep. Appetite changes. Significant changes in appetite, leading to weight loss or gain. Withdrawal or isolation. Social withdrawal, avoidance of social activities, or spending extended periods alone. Decreased interest or pleasure. Loss of interest or pleasure in activities that were once enjoyed. Irritability or agitation. Increased irritability, restlessness, or difficulty in managing emotions. Physical symptoms. Unexplained physical ailments or complaints, such as headaches, stomach aches, or muscle tension. Changes in behavior. Drastic changes in behavior, personality, or routines. Substance abuse. Increased use of drugs or alcohol as a way to cope with emotions or symptoms. Hallucinations or delusions, experiencing false perceptions, hallucinations, or beliefs, delusions, that are not based in reality. Thoughts of self-harm or suicide, expressing thoughts of self-harm, suicide, or feeling like life is not worth living. Difficulty, coping with stress, feeling overwhelmed or unable to manage daily stressors. Extreme mood swings, rapid and extreme shifts in mood, energy levels, and behavior. It's important to remember that mental health conditions are treatable, and seeking help from a mental health professional is a crucial step towards recovery. If you or someone you know is experiencing symptoms of mental illness, it's important to reach out for support and guidance. That's all we have for today. If you find this video informative, please like, comment, and subscribe. Take care of your health. Goodbye from us.